it's CJ. I have a weird question for you. Do you leak urine or pee yourself every time you sneeze, laugh, cough, jump up and down? That is what's called urinary stress incontinence, and although it is very common, it affects about 30% of the population, mostly women, but men can have it too. It is not normal. I know you've probably heard that it is normal to lose bladder control as you get older. That is simply not the case. So today I'm going to talk about the risk factors that can lead to urinary stress incontinence, and if you stick around, I will also let you know some of the treatment options that might help if you're struggling. Number 1, pregnancy. Growing a human can put a lot of pressure on that pelvic floor. And if you have a history of vaginal deliveries, especially if you've had a 3rd or a 4th degree laceration, those can actually damage the muscles in your pelvic floor. Number 2, menopause. As we age and our estrogen levels start to decline, we do lose tone in our pelvis. Number 3, obesity. Carrying extra weight can actually put pressure on that pelvic floor. Number 4, if you have a history of pelvic surgery, such as a hysterectomy. Number 5, if you have diabetes. Number 6, uterine prolapse, where your uterus is starting to droop down into your vaginal canal. And number 7, if you have an enlarged prostate or history of surgery for prostate cancer. Now here's the good news. Urinary stress incontinence is not life-threatening. However, it can really interfere with your quality of life. So there are a number of treatment options available. If you are struggling, I do recommend that you make an appointment to be evaluated, ideally with either a urologist or a urogynecologist. Depending on the level of severity of your symptoms, there are a number of different treatment options that are available. The first one is lifestyle changes, weight loss, and stop smoking. The second one, and this is probably the most commonly used, is pelvic floor physical therapy. Number 3, bladder training. Basically, you put yourself on a schedule of emptying your bladder on a regular basis. Number 4, medication use. Some of the more common medications, they may use vaginal estrogen cream, or they may use an antidepressant, Cymbalta, which has been proven to help stop urinary stress incontinence. There are also some other medications that can help with that bladder tone. And finally, number 5, if all else fails, there are some surgical options that are out there. If you do elect to have surgery, I strongly recommend that you do pelvic floor physical therapy afterwards, just to keep everything toned down there. So, have you had problems with urinary stress incontinence? What's worked well for you? I hope you'll leave that answer in the comment section below. And while you're in the comment section, you know I'd really appreciate it if you'd hit the like button. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.